Dr. Scott Whitten from the Nevada Center for Reproductive Medicine here in Reno, and I want to talk to you about IUIs. It's also known as artificial insemination or just insemination. And intrauterine insemination refers to the process of placing sperm up into the uterus, which is allowing sperm to get closer to where an egg is released from the ovary and picked up within the fallopian tube. There's different reasons why we do inseminations for patients. One of the most common reasons is if it's a male factor implying that sperm numbers are low. And if sperm numbers are low, then we want to give those sperm a big boost and head start to where they need to go. Ultimately, hopefully, they'll get to their final destination, which is the egg up in the tubes. There's other reasons, though, that we'll do IUIs for patients. Sometimes patients have a cervical incompatibility with the sperm, and therefore we need to bypass it, so we'll do IUIs for that reason. Sometimes patients have endometriosis and they need more sperm delivered to the tubes, and sometimes patients, female patients of mine, don't have a partner, and so they use sperm that's donated from a sperm bank in order to achieve a goal of pregnancy. The process in which we do an insemination in the office is really having to be well-timed to when an ovulation occurs. So ovulation, from our other videos, you'll understand, comes from the release of the egg from the ovary. Right before that is when you want the sperm present, available to fertilize that egg. So that's how we time it. So we time it either with natural cycles and checking ovulation predictor kits, or we might even time it with giving a patient an injection of HCG to release the egg. But once that egg is getting ready to release, that's when we would perform the insemination. So the way that happens is we obtain a sperm sample, and then it is processed in our laboratory. A raw sperm sample cannot be placed up into the uterus by itself, otherwise it would cause a lot of inflammation and perhaps even infection. So what we do is we wash that sample. We rinse out everything that comes from the prostate gland, the seminal vesicles, the things that would be harmful to the uterus, and we leave just the sperm in a very, very small volume of media fluid. And then the sperm is loaded into a small little syringe, and then into what we call an insemination catheter. And there's all kinds of different catheters that we use, but the most common one that I use in my office is this type here, called an insemiform. And essentially what happens is when the woman's ready to be inseminated, we place a speculum to visualize their cervix, and then this would be the cervix down here, the uterus. This is the insemination catheter. It's placed right up here into the uterus, and then we would let the sperm sample go. Remove this, take the speculum out, the insemination's finished. Sit for about 5 minutes in the office, and then they're discharged to home with instructions. After that, we want to check the pregnancy test for the patient in 2 weeks, and hopefully it's been successful. I hope you've enjoyed today's tip with inseminations. If you have questions, please feel free to contact our office.